Welcome to our video about laser toenail fungus. Laser toenail fungus. Laser toenail fungus treatments are fast and effective. The treatment takes anywhere from 5 to 15 minutes, depending on the severity of the condition. Some patients require just one treatment, while others must wait 30 days between treatments. Laser therapy is one of the quickest ways to kill fungus, killing it immediately. It is also a less expensive option. Here are some of the pros and cons of laser therapy for toenail fungus. Treatment options. The success of laser toenail fungus treatment depends on the underlying cause of the condition. Successful treatments can reduce the thickness of the nail and make trimming easier. Although this is a viable treatment option for onychomycosis, it is not medically necessary. There are other factors, such as pregnancy and other medical conditions, that may make it ineffective. In most cases, patients can take oral or liquid antifungals such as Penlac. The effectiveness of these drugs is only reported at 7%, but these medications can have side effects like liver damage. The Genesis Plus laser, for example, works by passing through the infected nail and surrounding tissue. This heat damages the fungal organisms, and the treatment is quick and painless. The Genesis Plus laser passes over the nail bed and surrounding skin, and the patient may feel a warming sensation during the procedure. It takes about 40 minutes for a full treatment for 5 to 10 infected nails. The length of each treatment session may vary depending on the severity of the infection. A prescription for a topical medication can also be used. Topical medications are not as effective, and it can take 2 to 3 months before the nail fungus has cleared completely. The only significant side effect of this medication is liver toxicity. A healthcare provider will check the patient's medication list to make sure that the drug doesn't interfere with other medications. Laser treatments have a lower success rate than oral medications, but they are still an effective option. A majority of patients experience improvement after treatment. Using the laser system, a dermatologist can get rid of the toenail fungus through repeated treatments. Depending on the severity of the infection, the treatment may take up to 3 months to work, but most patients are cured after one session. The laser system targets the fungus in the nail bed, killing it and promoting clear, healthy nail growth. Laser therapy is a safe and effective treatment, and most people will see improvements within 3 months. Effectiveness. To test the effectiveness of laser therapy for toenail fungus, you may want to visit a doctor. The Zirconia laser uses a special type of low-level laser. The laser is composed of thousands of pulses of energy that penetrate the nail plate. This energy is absorbed by the fungus and vaporizes it, killing it for good. The wavelength of the laser is approximately 635 nanometers, so the treatment will not cause any harm to the surrounding skin. The treatment usually takes between 15 and 20 minutes per foot. You will need 3 to 4 treatments spaced at least 5 to 6 weeks apart for optimal results. After one treatment, you'll be able to notice an improvement in the condition. You will likely need to wear socks or shoes that don't contain nail polish. You may also need to clean your toenails thoroughly to remove any dead skin. Once the procedure is finished, your healthcare provider will discuss aftercare to ensure that you've healed completely. The older lasers work on heat, so they may be uncomfortable and painful. But the Lunula laser is painless, FDA cleared, and has a 93% cure rate. It's worth checking out the cost and the effectiveness before making the decision. However, it's still expensive, so you might want to consider other options. If you're unsure of whether laser therapy is right for you, speak with a podiatrist to get a consultation. Lasers are known for their ability to kill fungus. The wavelength of the lasers is approximately 800 nanometers, and the pulses last 200 femtoseconds. They work by irradiating nail clippings from 99 patients with confirmed trichophyton rubrum onychomycosis. In addition to killing the fungus, laser treatment can prevent the recurrence of the condition. Cost. The cost of laser toenail fungus treatments is significantly lower than the price of over-the-counter medications. However, the effectiveness of the treatments depends on the extent of the infection. Several sessions are necessary for the complete elimination of the fungus. The cost of these treatments will vary depending on the severity and age of the patient. Laser treatments for toenail fungus are often performed in a podiatrist's office. The costs associated with laser toenail fungus treatment vary between practices. While most practices charge at least $1,000 per treatment session, the procedure is painless. However, it is worth it because there are no risks associated with it. This treatment can be a great option for those with advanced toenail fungus. If you are not able to pay the full cost up front, you may want to consider the cost of other treatment options. Laser treatment for toenail fungus costs between $1,500 and $3,500. Although laser treatments are highly effective, they require the patient to commit to their regimen and to prevent reinfection. During the recovery period, patients are encouraged to clip their toenails as short as possible. This will allow them to remove the infected portion of the nail. Additionally, it is important to clean their feet thoroughly before their appointment and exfoliate their feet afterward. Laser toenail fungus treatment is costly, but the results are permanent. Most patients are cured within a single treatment. However, some patients still don't have insurance coverage, which means that the treatment can be expensive. It is also time-consuming, and it's not covered by health insurance. However, this treatment is worth the cost, as it's not only effective for toenail fungus but is also affordable for people with moderate to severe cases of infection. Side effects. One of the main side effects of laser toenail fungi treatment is a temporary pain associated with tissue decomposition. However, this is temporary and resolves in a few days. A doctor can explain the proper ways to care for your toe after a laser session. While oral medications may be less painful, they often come with unpleasant side effects. Laser treatments are over 90% effective for most types of fungus. Laser toenail fungus treatments work by shining a beam of light into the affected area. Thousands of laser pulses penetrate the infected area and destroy the fungus permanently. The laser beam's wavelength is remarkably low, so it does not damage normal toenails or the surrounding skin. A laser session can last anywhere from 20 to 40 minutes. The procedure can be repeated as needed. A pinpoint-shaped laser passes through the toenail to kill the fungus that causes toenail fungus. Because the laser is harmless, there is little to no pain from the procedure. Patients experience a warming sensation and pinpricks from the laser. Most patients will notice a reduction in symptoms after the treatment and will be able to enjoy a clear, healthy toenail in 8 to 12 months. Depending on the severity of toenail fungus, laser treatments may take 5 to 15 minutes per treatment. Treatments should be spaced 30 days apart. As with oral medications, it takes a new nail between treatments to grow completely. Most patients will see results after just one session. If your toenail fungus treatment doesn't work, you should consider using another treatment method. Precautions. If you've been experiencing thick, yellow toenails, you may be suffering from toenail fungus. A doctor at Markham Foot Care Clinic can prescribe laser treatment for thick yellow nails and provide treatment options based on your lifestyle, health, and overall condition. This new technology has been proven to be effective in the treatment of thick yellow nails. In addition to being FDA approved, laser treatments can help treat other conditions as well, including athlete's foot, corn on the soles of the feet, and hammer toenails. Laser toenail fungus treatment uses a pulse beam of light to vaporize fungus that's embedded in the nail bed and nail plate. The laser's frequency is tuned to a certain wavelength and affects the cells responsible for the infection. Different lasers use different wavelengths and pulse frequencies to combat specific types of fungus. Patients should know exactly what they're getting before the laser treatment to ensure a successful outcome. Before laser treatment, patients should wear new, freshly washed cotton socks or flip-flops. Another pair of shoes should also be worn after the procedure. Patients should wear flip-flops and rubber-soled shoes in public to minimize the chances of infection. Also, patients should take steps to prevent fungal infections from returning. By taking these precautions, laser treatment can provide permanent results while allowing people to remove their shoes in public. The treatment process usually takes less than an hour. Most patients require 3 to 4 sessions, although some cases may need more than one. A patient may need to undergo 2 sessions if they have a severe case. Each treatment session should be spaced at least a month apart. A first-timer is also at a high risk of developing a recurrence of the infection. Fortunately, with laser toenail fungus treatment, you can get rid of the infection and prevent it from coming back. Thank you for watching. Please like, comment, and subscribe if this was helpful.